Hi, everybody. This is Kathy Homeyer, and I guess this is under the title of my nourishing or nutritional energetics broadcast. I guess I'm coming to you from my Lake Clear Lodge and Retreat. I am in the retreat center, or a conference center. You can see our beautiful, very high ceiling, beautiful building overlooking gorgeous Lake Clear that has a sunset view of St. Regis Mountain. And if you're joining in, I will be able to see some comments down below. So comment if you're here. Let us know you're here. I'll put up on the screen here. Let us know you're here in the comments. Let us know where you're coming from, if anybody's online. We posted this last minute. So if you are here, we'd like to know. And I'm here with Deanna Courtney. Hey, Deanna.
Hi.
We have trained ourselves to do slow movement so we don't glitch out, because we like to get a little crazy. But we're here today to talk about, Deanna, how would you explain what we're here to talk about?
Well, you have somebody that you care about that possibly just got diagnosed with Lyme disease or suspect that he might have some Lyme disease symptoms. Right. So you wanted to have the German New Medicine perspective of Lyme disease. So that's what we're going to do.
Mm-hmm. Yeah, a good friend just was taken to the hospital. They didn't really know what was up. They gave him the typical tests, antibiotics, sent him home, and I looked at it from a different perspective and tried to share that information. But this is awesome because it's come up a lot lately, so we thought we would do this to share our perspective.
Yes, and a couple of weeks ago, I did a talk in Lake Placid, and it was well received. It was pretty neat.
Yep.
So basically, German New Medicine is a science. It's an actual science of my summary is how the body heals. Why it has symptoms, why on the right, why on the left, like there's particular science. So Dr. Hammer, he lived in Germany, he's from Germany, hence the name German New Medicine, discovered this in the late 70s, early 80s because of his testicular cancer. And what I'm going to give you just the summary. Usually I do a whole hour and a half presentation, but the summary of this is what we are told are diseases are natural symptoms of a progression of healing. Mm-hmm. So when somebody calls me and says, Deanna, I have this symptom, it tells me a particular thing that's happened in their life, an unexpected shock. When that unexpected shock happens, that energy literally hits our brain, a part of our brain, and the brain runs an organ. And right at that moment, we're in what we call conflict active. And the organ level either breaks down cells, builds up cells, also known as tumors, or you have an organ that has a different, like hypo or hyper, a functional change in the organ, depending on where it hits on the brain. Now, Kathy, you have a picture of a CT scan, a brain scan, the other one.
Yep.
Oh, the other one. There we go. So this is an actual, this is a particular phase of healing of a hit to the brain. So medically, they'll look at it and say, they can call that brain cancer. But this is a perfect example of what the brain looks like at a perfect particular phase of healing. Mm-hmm. So the psyche perceives life, the brain responds to it, and the brain tells the organ what to do. And they're all purposeful to get us through that conflict or help every symptom that we have ever. We can be poisoned. We can have accidents and have symptoms. We can be poisoned and have symptoms, but all other symptoms of the body are these unexpected shocks.
Right, and I just wanted to clarify that this is not a brain injury. This is the result of these CT scans are the result of a conflict shock, just like when Deanna just, slurred her words, her brain could go, oh my gosh, am I going to talk right for this show? And she could get a ping, I call them pings, a ping in the brain, yep, which would go to a core wherever it was in the brain of how she perceived it. It would ping in that particular area of the brain, which would correspond to the particular organ that it does biologically in the body. And if she didn't resolve that quickly, it could hang on, or it could, in a perfect world, it does create tiny symptoms, and you resolve it and it's gone. If it lingered and it stuck with her, then it would be a long-term symptom or return of symptoms. And but every little conflict shock, every ping, every unexpected shock gives you a little ping in the brain. That's not a brain injury. That's or at least we don't think so. That's an unexpected shock, and you can highlight that in brain. It can be seen in brain scans in every single one.
Yes. So all women that have had intraductal brain have a certain ping in a particular spot of the brain, and it looks one way, like target rings in one phase. Pull up the other one, the German New Medicine Compass, Kathy, please.
Okay,
so
there you go.
This is the German New Medicine Compass. This is what Dr. Hammer basically put together as making sense of any symptom. So when somebody calls me and says they have a stomach pain, well, that tells me where they are on this. So I ask a few questions, what's going on in your life that is of this theme, and it tells me where they are. So the first triangle on the left shows that's when you basically go from normal day-night rhythm, and that is the unexpected shock. So you can have one situation that actually creates multiple hits to your brain, like a fear in the territory and unexpected loss. You watch an accident and you see your puppy get killed right in front of your eyes. You could get 3-4 hits to the brain because of that one incident. So that's what that first triangle represents. The mountainous bump up and down is the conflict active, is when you're trying to think of things like, how do I resolve this? It's always on your mind. You wake up in the middle of the night, your hands are cold, your feet are cold, you don't have much of an appetite. This is conflict active. We know that as fight or flight is a common term. So that second triangle represents the conflict resolution. So the psyche goes, I'm glad that's over. And then what happens in this healing phase is whatever happened in the conflict active, if there was extra cells, also known as tumors, well, the body is going to break that down. The body has little surgeons we call bacterias, yeasts, funguses, viruses, if they exist. That's another story. And I might be forgetting one. But we have little surgeons on board that go in, they break down, they do the right thing. And then when they're bringing through this phase, after healing phase A, we go into the epicrisis. That's when we have our seizures, our heart attacks, our asthma attacks, our itching, our pain, muscle cramps, any number. That's usually when we go to the hospital, is in that where it says pain and inflammation. That's the epicrisis. After that, the healing phase B is my favorite phase. It's called the rest and rebuild phase. I changed the name, thank you, Dr. Hammer, to the rest phase, because quite often we don't give ourselves enough time to get through this. We just try to bounce out, and we got to get back to work, and we got to get back to making food for our family, but we need time to rest and rebuild the tissue that just went through this whole cycle. So that's called the German New Medicine Compass, and every symptom tells us what you've been through, and it's beautiful. So when we're talking about Lyme, there are common symptoms. Kathy, what symptoms do you know as common Lyme symptoms?
Well, quite honestly, I've learned to stay away from the fear of disease, and I just looked it up before the and except for when my friend just got diagnosed with possible Lyme disease, and I knew his symptoms. He movement was slow, joints were stiff, um, and that's really all I know because I've kept it. Now that I know this type of system, the way the body works, the way the body is always working for you, I'm very much less in any kind of fear of disease per se because I go, oh, what was that? And I wanted to share a quick example of this. The other day, I'll tell you quickly, I watched myself go through that cycle with an unexpected shock. I had carpenter ants that I was dealing with in my lodgings, and I'm like, no, that can't happen. And my brain went into this cartoon, video of the bugs eating the house and the house falling down. And I knew that wasn't real, but that's the way my brain perceived it really quickly. And I went, oh my gosh, this can't happen. We have to deal with this. So I went back to the lodge and I did deal with it myself. And then I went to sit down for dinner. I got this really sharp pain in my stomach. I mean, sharp. It wasn't even, I'm thinking, geez, did I not eat for the day? Because I started thinking, what was that? I started drinking water. I started, eating a piece of bread and thinking, wait a minute, this is a program I'm going through because of the shock that I just got and perceived in my head that was very important. And I just went, okay, this is just a program I'm running through. This is going to be fine. I'm safe. There was no threat to me. And I experienced the pain in my stomach, just really woozy, wanted to go crash. So I did. I got up, I went and crashed on the bed, just wanted my eyes to close. And then I thought, okay, I'm out for the night. This is just going to be a long program. And I'm not sure if that at the time I thought it was related to that, but as you go through it, you don't really kind of think that. When I'm out for the count, 5 minutes later, because I just kept saying, I'm fine. This was not a threat. This just needs to run through the cycle and I'm fine. And 5 minutes later, I kind of went like, I'm out for the count. 5 minutes later, I felt fine. I was back up, I ate dinner, like nothing happened at all. And because I could identify it and not be afraid of what was happening. Now, if I really would have been afraid, because those pains were really sharp, they could have gone on longer. I could have reacted drastically and went, oh my gosh, I've got to go to the hospital. Now, this is just a really extreme example, but because I knew this, I was able to, it ran through like 20, 25 minutes. It was extreme, done, gone, and like it never happened. So that was just a quick.
That's the amazing thing about awareness of this. And so I encourage people to learn this now when you don't have a serious diagnosis, because you can see the little stink conflicts happening, the little anger in the territory. Whenever you have a sneeze or diarrhea, those tell you just what went on in your life. Mm-hmm. So as far as the Lyme, I have a little printout because, like you, I don't get into the medical, but I kind of have to do when I listen to people. But fever. So actually, keep the German New Medicine compass up for me, please, for us. And so the most common sign of infection is an expanding area of redness on the skin. Oh, give the shoulder. Let's give our man shoulder. So everybody knows the typical target mark. Well, this was not caused by an insect. This was caused by a sudden awakening. He was in a deep, deep, deep sleep, and one of our workers went to wake him up, tapped him on the shoulder, and really startled him. This is called an attack conflict. So where this correlates to the Lyme, it's coming from the tick. Well, about a year ago, I experienced my first tick. And they're creepy. They're really gross. Like they get on you and they're so grabby, and then you pull them off and then they don't let go. So I can see where that would feel like I'm being attacked. And then when you don't know they're there and they actually get in your skin, that's a deeper attack. So of course you're going to have a bigger ring around it. And then if you're not aware, here, Like if you don't realize, like, oh, I just got bit by this tick. And if you know German new medicine, you're going to take one phase, like, oh, okay, I'm going to get him out here. That's kind of gross, but I'm going to get him out. Zero fear. But if you think you know everything about Lyme and what causes it, you're going to be, oh my God, what's this? Going to get Lyme. And oh, and then it's like, what's wrong? It's red. Oh, it's bigger. And the more fear you put on it, the more water actually goes to. That's another program that runs that brings water to the area so it'll look bigger. And then it's in the wrist. And then you're self-devaluing, which affects the tendons or the cartilage. Or if it's like huge because you're a typist and you have to use your wrist all day, you're like, oh my God, I'm going to lose my job. And it just escapades or escalates and escapades. And then it's a big escapade. And that will affect the usage of your bones. So when they test for the bacterias, and sometimes they find it and sometimes they don't, well, when they find it, that says that you've just had a unexpected shock, self-devaluation it's a deep one because it's gotten to the bone. Those 5 bacterias are only found and created in that level of the bone. Mm-hmm. So that right there tells us you've got a huge self-devaluation. So when I'm working with somebody and they have joint pain with or without the target mark, I know they have a self-devaluation. So I say, what's going on in your world that is about the use of your wrist? Like, how is it typing? Is it some kind of job related? Like, what was the unexpected shock that you started self-devaluing? I'm not good enough. I'm not strong enough. I'm not typing fast enough, whatever. That might be fingers. I'm making up some stories here. Mm-hmm. But that tells me what's going on up here in your thoughts about this. And so all somebody has to do, like you said, well, this is not a big deal. The ants are not going to really take down my house. Like, you change perspective. That's what we do. So we've got to realize that the pain is serving a purpose. The pain is at the peak of healing, the pain and inflammation. So it's actually rebuilding the tissue. That's the purpose of the pain. The purpose of the pain is also to say, don't use me. Like, we're getting to the rest phase. And so stop using me so that you stop feeling the pain. Like, that's the brilliance of the body. But we don't always listen to the brilliance of the body because we think we're smarter. So all those are beautiful. But when we change perspective, that will go right through healing phase B and out the other end, and you'll get back to normal quicker. With awareness. So the trick to symptoms is realizing, like, as soon as I have a symptom, what just happened, that is blah, blah, blah. It's a healing symptom. It's fine, perfect, blah, blah, blah. And I'm not saying, and I always have to say this, I'm not a doctor. I teach German new medicine and the understanding of symptoms. You can bleed to death, and there are certain symptoms that are heavy healing. So you don't just listen to this and go, okay, I'm just going to heal myself. No, you've got to know and understand. I just was figuring out how many years I've been learning German new medicine, and it's been 5. Mm-hmm. And I don't know all the programs yet, but they happen, and I'm like, oh, there's another program. That's pretty cool. But well, there's not.
Yeah, you know enough that you can say, someone can say, here's what's going on with symptoms, here's what's going on, and then you'll ask questions about what's going on in their life. It is so different depending on, and not to get complicated, but how handed they are can give clues, whether they're right or left-handed, and different sides of the body could give clues to something. So you can find the clues, and everybody's different, and this is why we can't find commonalities in regular life, I guess, if you want to say that, because we're all different in these. You could look at that, you could have been laughing at me about the ants, and that wouldn't have affected you at all because it's not your house. And I kind of went crazy. So it all depends. Even if you see the same thing, different people, you see the same accident, even people are going to perceive it differently and run different programs. So that's why You look up the symptoms, you look up the programs, and you figure out where the resolution is on pretty much a one-to-one basis. And that's the neat idea. It's very structured in its cycle, so very different in how somebody perceives it and how you might go about talking to somebody about it.
Right. And just because you had a certain event in your life doesn't mean that you got a certain hit on your brain.
Right.
And it's surprised me a few times. A couple times something's happened. I'm like, oh, I got this. I didn't get a hit. And 3 weeks later, there's my symptom. I'm like, really? I really tried to but our brain is not in charge. Our psyche is. Our psyche is running the show. So back to a couple other symptoms. So the rash is typically neither itchy nor painful. So the guy that had the target mark on his shoulder, he didn't even know it was there. And I saw it the next day and went, whoa, that's pretty intense. But it won't, that was in conflict active, and it won't get, actually that's probably healing phase A. It won't go into healing. It won't get itchy until inflammation and pain, the epicrisis. So early symptoms may include fever. Well, fever is at the epicrisis. The epicrisis is at the peak where pain and inflammation is. Fevers are present. That is a normal process. Headache. Headache is usually where you got the hit, the unexpected shock. At the peak of healing, at the epicrisis, that swells. Water goes to the site of the brain hit and the organ hit. And so that's why there's pain and inflammation, because the water's there. Feeling tired. Well, we talked about that earlier. That's healing phase B of all programs. So right now there's everybody running a different program, and at the end of it, there's the sleep phase. So people that have been so tired for 6 months, they're over a conflict, but it was a long, intense conflict. So a couple years, 5 years, 10 years conflict. And the healing phase B is just long and intense. They call that chronic fatigue. We call that you're just in the healing phase. And the beauty thing is when your family knows this and knows that you just went through this work issue for 2 years and it's finally resolved because you quit, and then you go into healing, they're not mad because you're not out getting another job. They realize that you've got some healing to do. In fact, they probably prepare for it. In my family, we would prepare for it. Is go, realistically, you're going to have some hit someplace because it was constant. And so healing phase B is coming. So you've got to be prepared for that. You're not going to want a new job when you're in this phase. So tiredness is very common. Well, it's part of the program. So if untreated, symptoms may include loss of the ability to move. That's a stuck conflict. Like when you get certain diagnoses, and let's say we'll pick on my wrist again, and like if I'm self-devaluing and breaking down every day, I'm breaking down every night, it fixes, I'm constant, what we call tracking, and there's a lot of destruction. At some point, I may just, a doctor might tell me that it's something else, it's MS, or it's this or that. And depending on how I perceive that, I could get another conflict. So there's a stuck conflict where you feel stuck in something. Like if my hips were constantly and I couldn't move, and they say, well, you're going to be in a wheelchair because that's the progression of this disease. We'll talk about another stuck conflict. So we've really got to be aware with what we allow. We're basically asking people opinions of our body, but when we know German new medicine, we don't. We can look at the science. Severe headaches, neck stiffness. That can either be, the neck is about self-devaluation and it's about intellectual. So you picking on me. You're picking on me of my little speech issue early on. That could be like, oh, I'm so stupid. How did I start that? And that would affect my neck. And it probably would affect my right side because it's about my business, not my left side because that's about my mother-child side. So you're not my mother. You're not my child. You're a business partner. So it probably would affect my right. And the funny thing is you're just using that as an example, but my perception of receiving that is what actually does it, not your words or your intention. Right. So that's interesting. Memory problems. If you have certain hits in different areas of the body or of the brain, there is a natural process of a memory problem. So it's in the epicrisis. It's at a certain phase where you're going to have little lapses of memory. I sat down with this woman one time. We were having dinner and we were just learning, talking about German new medicine. And I mentioned this and her eyes just got big and she's like, "Are you serious?" She said, "I went on vacation after getting done a really stressful period of my job. And I got the pictures back and there were 3 days that I didn't even remember." And so she was obviously running that program. And during that phase, she just didn't remember.
We talked about this when I talked with this echo side. We talked about this before about how when you go on vacation, why does it seem like you always get sick? Sort of. And I'll post other
conflicts behind.
Right.
You're resolving all your conflicts temporarily or permanently. Mm-hmm. And so you have little stuffy noses, you have little sore throats, stink conflicts, I can't swallow this, bite conflicts, teeth issues, and you blame it on the flight. Oh, the stale air in the airplane and the person behind me was coughing and I caught the cold and the whole shooting match. So yeah, that's a good point.
And I'll post those below in the comments. I'll post other videos that we've done so they can see the different areas as well and see it at a different time. I'll post things below in the comments.
Yeah. I have one story on Lyme. So a family member of mine had Lyme and I did not know German new medicine, but when I did, which was shortly thereafter, I remembered what was going on in her life. So here's the story. So this young woman, she's pregnant actually, probably 4 months. It was springtime, like early summer, late spring, and it was pool day. The pool was opening up and she was going to get in a friend's pool. So she did her shaving. She shaved her bikini area and nicked herself. I'll say attack conflict. So as soon as the conflict happens, I'll tell you what kind of conflict. So first, attack conflict. So she gets to the pool and she realized that they didn't clean it, but she didn't want to make them feel bad. Didn't want to give them an unexpected shock. So she went in, but all while she was there, she was like, "Oh my God, this is going to get me infected." And she didn't know German new medicine either. And she's like, "Oh, it's going to get in there. It's going to be." So she was all crazy. And then, so another attack conflict, attacked by the green slime that was floating all around. So she gets home and she's looking at it and she's like, it's getting bigger and bigger and it's this big, moving all around. And I don't know if there was a clear target mark around it, but it was red and swollen. And so there was a progression of over the first couple days of fear, and she kind of gets into her head and the fear takes over. So the more fear takes over, the more water goes to the site, and then the more like, what's wrong, what's wrong, what's wrong, self-devaluation. And when you self-devalue heavy, it starts affecting the bones and the joints. So she teaches yoga. So what started happening? She had less mobility. So conflict, I'm not moving right, self-devaluation. I'm in pain, self-devaluation. There's third and fourth conflicts. And so then I don't know if I'm going to be able to teach my yoga. There is the syndrome, which, because if you're not making money, that's food. And the syndrome is about existence. Like, how am I going to live if I can't make money and get food? So that syndrome, more water to the site, more pain, more inflammation. Conflict number 6. At the same time, she was working on getting a gig, a specific type of yoga at a barn, equine yoga. And she found out via Facebook that this person hired somebody else instead of her. And she was working, like they were so close to getting the gig together. And that was a huge unexpected shock. Self-evaluation, performance, partner side. So there goes her knee, her right knee. That's about performance. And so she starts having her pain in her knee at the same time. So at some point when the knee started, she went to a naturopath. He diagnosed her as Lyme disease. So I don't know if she tested positive for the bacteria, probably. And so that's the end of the story for the sake of my story. She went through some treatments and she resolved her conflicts ultimately. Sometimes medications can give us that confidence that, like, oh, it's better, it's better, it's better. So they can play a role in us not self-evaluating. And I think that's what happened here. But that was the progression of her Lyme disease. There was not a tick involved at all.
Mm-hmm. Yeah. And Lyme disease seems to be that the information about it seems to be so prevalent. And we live up in the woods. I grew up here running through the woods, and we never had cautions against anything like that. I ran through the woods for years and years and years. I don't even know if I saw one or not, but if I did, if they were, it was it was the woods.
I actually wrote 2 stories. So I'd like to read these 2 stories.
On your website, Deanna?
It's not on my website. It's right here. I wrote it for my presentation. So do I have 2 minutes?
Sure.
They're great stories. So I actually have 3, but I'm going to narrow it down to 2. So this is from a person that I don't know GNM, German New Medicine, but I know a lot about Lyme. I got home from a walk in the woods and found a tick on the side of my knee. Oh no, I know about Lyme. I've heard all the stories. I see the target mark within a few hours. Oh crap, that's the first sign of Lyme disease. I posted on Facebook. My friends tell me to go to the doctor and get tested. Fear. They wrote stories of death, existence program. The spot got bigger and started to be hot, and I felt pain inside to my bone. I woke up, my knee. Oh, it hurts. Oh, this is so bad. Pain in the joints. That's another sign of Lyme. I went to the emergency room. They said, this looks bad. The last time I saw this, the person ended up in a wheelchair. Oh, crap, I have to work. If I don't work, I can't live. I'm a single mother. I was at work and I could not do my job. It was bothering me so bad. The pain. Oh, no, I'm going to lose my job. Oh, my knee, it's getting bigger. Oh, my God. I got the test back. It's negative. But they said that doesn't really matter because the person in the wheelchair, they got tested negative too. Oh, God. Spiral down the hole. And then I know GNM. I found a tick buried up to his butt in my knee. Oh, wow, look at that. It looks like I'm being attacked. I take a breath. Well, this is kind of gross, but let's get him out of me. I use tea tree oil and it forces him out. This is pretty gross. Breathe. This is creepy, but I'm okay. I got him off. I'm okay. It turned red for a day or 2. Then it itched. I had a short nap. Let's go on to the next adventure.
Yeah. Yep.
They're a little exaggerated, but not.
Mm-hmm. Mm-hmm. Yep. It's that what we have been told the symptoms of a disease, and then we treat it with other things. And again, sometimes they have their purpose. But the symptoms, we've kind of look at things a little backwards, even though we know if we cut our finger, it's going to heal. If we, unless we go into a fright program or something. But if we have, I work in the kitchen, and for the first time in a long time, or actually ever, I cut a little tip of my finger off, but I went, okay, it's going to grow back, and it did. I got most of my finger there, it's fine. starting to go into a fear program and go, it's going to heal this, the skin goes over, you see the scabs, but when other things happen inside the body, you take it very differently.
Because you can't see the hits. And that's a really great point. And I don't think we've ever talked about it, but that was a really, during one of my presentations, I was like, I have all kinds of pictures of attack conflicts, from moles to the bullseyes to some caused by verbal attacks, some caused by physical attacks. So I have all kinds of pictures of those. And we know what's going to happen. We know it bruises. We know it gets painful. We know the process of healing because we've seen it enough time. Right. We know when we get a sunburn what it's going to feel like and what caused it. But those other things on the inside, we have the same programs that do the same thing, except we have, up until now, we have not had the proof to say the cause of it, but now we do. We know the causes of breast cancer. We know the causes of testicular cancers. And we also know the purpose of those symptoms. So we can just remove the fear and sometimes steer toward a surgery and sometimes not, depending on your belief structure. So just because you know German New Medicine doesn't make you the healthiest person. Somebody asked me that. So you know all this, so you must be really healthy. Well, I wish I could live in the bubble and not have unexpected shocks. When my grandson got bit in the face by my son's dog. Like, that was a shock, and I handled it. But when I went into healing, I had 4 or 5 symptoms. And it lasted about 2 weeks. Like, they were pretty heavy symptoms.
But knowing it helps that you didn't keep them from the symptoms from coming on, because otherwise that could turn into a hanging healing or conflict, and that could be kind of festering for years and turn into some other symptom or disease. I'm just meaning that it could be there for a while, but knowing that it happened, but you were still able to push it through easily.
Yeah. And when they came on, I was like, oh, that's how I perceived it. I have scare fright and a speechless conflict. And so it was pretty interesting. And it teaches, every time symptoms come on, it teaches us about ourselves.
And how we're reacting to things. And
ultimately, we want to get to the point where we're kind of like not shockable. We don't want to be numb to everything, but really when we understand our power in the world and our place in the world, and that we are really just victims of just little creations that receive whatever's going on. I mean, some people are like right on edge, like just think of their poor brain. And some people, like, things don't faze them. And that's kind of where I've gotten with this knowledge, is like, okay, I see that happens. That's a normal part of life now. And so I will bless, I'll support, I'll do all these things, but I don't have to worry, and I don't have to turn it into a bunch of other stresses.
A great example is the person that you see drinking and smoking and, doing all crazy things and never getting cancer or liver problems or whatever. And other people who don't even smoke might get, lung cancer or something. So that's a great example of those things. When you go, wait a minute, I'm doing all the right things. Why am I getting this and they aren't? So.
Yeah. And so, German New Medicine just answers that.
Yeah, for
my website.
I signed up a couple times. Upyourvibe.us. Is that the one I should be putting there? Okay. So
I have a story up there of how I learned of this, because, like you said, we were doing all the right things, from eating right out of the farmer's garden that didn't do pesticides, and we knew all those stories. And there's my partner growing a big old lump on the side of his neck. So my story's there, and Dr. Hammer's story is there. And I encourage everybody to learn this now, because literally in one generation, I feel blessed. I have 2 grandkids right now. And I know with the parents' knowledge of this, they are not going to have the fearful cancers, Parkinson's, heart disease, none of those.
Mm-hmm.
I'm not saying they will not have the symptoms of those, but they will understand them if they show up in their life. And then if a situation shows up that could give them that, you try to downgrade the symptom. You try to resolve the conflict sooner than later, because a little conflict gives you a little sneeze. A long conflict will give you a sinus infection. Same program, but do you want to sneeze or do you want to have a blazing infection, which is not an infection, it's the workers' stuff.
Mm-hmm.
So yeah.
So in the case of my friend who they started to diagnose sepsis, which was is pretty serious, but they sent him home. I think he's slowly recovering. But what I was trying to say is, wow, you're really into a deep healing cycle. And so, what might you say to them? Would that be something where he could kind of look at that and go, wow, I have the chance of pushing this through now? Or would it be something like that?
Part of your words just skipped. I have a chance to what?
If he's in the healing cycle, then he could actually stop the cycle. If he knew.
You don't want to stop the cycle, because it all, like, your body, when you resolve a conflict, it's going through it. You can do a lot to stop it. You can take medications to stop it, but it's going. To understand why it's doing so, we look at specific symptoms. So I want to know, before the sepsis diagnosis, what brought him in first? What were the specific symptoms? And if it's involving blood, that could be a full body self-evaluation. I need particular, not. But
I mean, with the information, he could flow through this instead of going through even a worse cycle later. Yeah.
If there's fear, he's going to have worse symptoms. And usually, when you connect my symptom with the conflict, so that's usually what I do in a consult, the symptoms will diminish 50%. That's when you know you hit the conflict on the head. Because all the body wants to know is that you're safe. Like, I'm glad, this is the only reason why I have this symptom. Oh, perfect. And then the symptoms to come are predictable. And that's the beauty of this. It's not like, well, sometimes people have this symptom after this, but sometimes they don't. No, if you have this symptom and this program's running, here's what's to come. So if bleeding's involved, expect blood in the toilet. Would you be happier to know that you're going to bleed rectally from a certain healing program, or not know? It's like, if you know that, like, when your tumor is breaking down, you're going to have a little blood that shows up in the toilet. So you'll be looking for that as a sign of, whoo, yay, we got to that healing phase. Versus not knowing, you have symptoms and you look down in the toilet and you're like, you say all these really bad words and you're scared. I like to swear, but I can't. This is live. I don't like to swear, but there are certain words that we just have to say. Certain things happen. So the knowledge is just so empowering. Yeah. And our ultimate goal is to remove fear. Yeah. And so kudos, because you have so many different modalities, and a lot of times when in German New Medicine, they can't figure out how it fits, but really it is the foundation of everything. And then you build up there based on the person that you're working with, their values, their beliefs, their fears. And so it's neat that you've really started learning this, and then you can help your people. I say the practitioners that learn this, you can help your people even more.
Yeah, and they need
very normal.
Yeah, I mean, I do some energetics, but the neat thing with nutrition is, I mean, I've been learning, every single nutrition, diet, everything that lives. And when you look at German New Medicine, just to bring this in for a second, you need different nutrition at different stages of your cycle. So that gives you even more information about what you should, and it's pretty and you're pretty much going to want to do what you are, but follow the intuition on what you want to eat and what you don't eat. When you're building tissue back up, you're going to need a lot of protein. So it was neat to see even the nutrition factor in knowing where you are in the cycle can help you feed your child correctly or yourself correctly and know, yeah, I do want that, and there is a reason I want that. I can go ahead and have that. That's good. So,
and when somebody asks for something, like that's their internal knowingness. Like, I worked with elderly, and they had an epicrisis, and for some reason he asked for cream of mushroom soup today. Right out of, he's never done that. I've cared for him for 2 years, and he wanted cream of mushroom soup. That must have something in it that his body needed. Mm-hmm. And it was pretty interesting. So when we're working with our children, grandchildren, our mothers, our elderly, we've got to respect their knowingness about them, from do they want to go to the hospital or not, and stop really making them do things. Like, Kathy, who knows best what's good for your healing?
Yeah, myself.
You.
Mm-hmm.
I know my fears, I know my beliefs. That makes the decision. But for some reason, with little kids and with elderly, we think that we know better. Mm-hmm. And sometimes with our husband, I mean, if they want to lay there and just go, it's their right. We've got to start really respecting people's knowingness of what they want and get rid of our fear of we're going to lose them and blah, blah, blah. Like, it's just
mm-hmm. Yeah. I was thinking
I could get up on a sofa.
we have to think of people who are in symptom mode the same way as people who are pregnant. You go out and get ice cream for them, and you go do pickles, and you go do this. So we have to think of it that way.
Yeah, Dr. Hammer calls that dance around the patient.
Right.
Like whatever they want, make coffee. That's beautiful.
Mm-hmm. Yeah.
Yeah.
Okay, so any other comments about the Lyme symptoms that we've missed yet or haven't told people about?
If we miss them, I mean, when you go to a doctor, they're basically just trying to diagnose you. That's their job. And it's not that they're doing anything wrong per their modality. Mm-hmm. But when you look at symptoms, they tell us the specific type of shocks. Mm-hmm. And so there's always, I mean, I've been doing this for 5 years. So with my family, friends, and now with different clients from all around the world now, it hasn't failed yet. There's only been like 2 times we couldn't find the conflict. And that's when it's 30 years past. Mm-hmm. So it's so important to kind of nip it in the bud first, because then you stop chronic issues. Mm-hmm. Like I have a chronic back issue that has gotten a little bit better since I saw you, Kathy. So we're working through it. But it's been since I was 11, and that's like 40 years ago. Mm-hmm. So had my mom known German New Medicine, we would have addressed it right then and there. Like, where are you not being supported? Like, what just happened? Was it in school? Was it on a track team? I wasn't fast enough. Was it? Oh, it was cheerleading. It just came to me. I couldn't jump high enough. They just wanted me for my mom.
And it's amazing because sometimes when you start talking about it, in people that I've told about it, they go, I don't know, I can't jump. And then you just start thinking about it, and maybe like literally weeks or months later, you figure out, oh, it was that. Yeah. And you actually get it, and you know when you get it. You go, oh, okay. Because and then your mind goes, okay, I'm safe. That's done. I don't need to. I can go through.
Right. Yeah.
So the biggest thing to tell people is to know that your body really is doing the right thing, even though we were kind of maybe taught a different way. Get help when you need it, but know that your body's doing what it's supposed to be doing, and start learning the awareness of this type of program, or that there's answers that you can get, and just know, even if you have a little inkling that, hey, I'm safe, this might not be so bad as I'm taking it. hang in there and find out a little bit more information. And the sooner the better, or learning before those things happen is the best too.
Yeah.
A little bit at a time.
Symptom that comes up, I always say, thank you, body, for healing me. Thank you, body, for healing me. Like, I don't know German new medicine like Deanna and Kathy, but thank you, body, for healing me. I know you're serving me either to get me through a conflict or fix my tissue, organ, brain level. Thank you, body, for healing me. Take deep breaths, calm down, try not to get in the fear mode, keep somebody around that knows you, loves you, a dog, an animal, and go to sleep. Because you have a 98% chance of waking up. Like, that's Dr. Hammer's statistics.
Yeah. Yeah. And there's more out there. Okay, Deanna, well, if there, anything else, we can end the show.
We can all day long, you know.
I know, I could do. We could, and so we'll do more. I mean, if anybody wants to either email either of us, I had put both of our, I'll put it up again, the websites. I actually put yours up, Deanna, and mine as well. Or if you just want to email us from there, or if you want to say your email, Deanna, that's fine too.
They can find me on my website.
Yeah. If you want to email either one of us, that's fine. You can request we love talking about the different symptoms. So if you want to request a symptom that you are having or someone else is having, contact either one of us and we'll try and set it up for you. Okay.
Great.
Okay. All right. Well, thank you once again. Thanks for everybody listening and on the replay. Put your questions below, even if you're looking at on the replay. Hopefully we will see, they should ping us. So we will see your questions and comments. And yeah, thanks for watching. Okay.
Thank you.
Bye.
Peace, everybody.